How you doing, guys? Dr. Thompson here with Exemplify Health Center, your Wellness Way affiliate in Yorkville, Illinois. Happy Monday evening, guys. It's almost 7 o'clock, and I'm just finishing up right now and ready to spend some great time with you, giving you some great information that you can take with you on your journey towards health. If you are watching right now, go ahead, please say hello. Please let me know where you're watching from. I always love to see where everyone is watching from Canada, Australia, Europe. United States, let me know. Guys, I read all of the comments. I promise that. Sometimes I can't respond to all of them, but let me know where you're watching from. And guys, if you're from the Yorkville area, please also let me know as well. It was a beautiful day today, yesterday, and today. I'm starting to get the itch to go out and do some landscaping. People are like, you do landscaping? I'm like, I don't know why. I love it. So give me some mulch and a tractor, and I am happy for hours. So I'm getting the itch to start to do that, all right? I don't know about you. All right, guys, we're going to go over something that hopefully will enlighten you quite a bit. Hopefully you're going to have an aha moment. Because I'm going to go over with you today common symptoms of inflammation, and in fact, many people don't realize that it is in fact inflammation, that are very, very common, guys. A lot of people have them, and they're absolutely not normal, okay? I have this, I don't know if you call it a fault or whatever, because, you know, being a chiropractor, being a wellness way doctor, I'm always watching people, all right? So I'm always watching them to see how they align with gravity, looking at their posture, looking at their gait patterns, how they walk. I'm looking at their skin, and in fact, a lot of times when I'm just watching people, or I might be at a restaurant, or I don't like to go to stores. I don't like to go shopping, but if I do, I'm always like, yeah, the person has type 2 diabetes. That person's got an inflamed gastrointestinal system. That person's suffering with terrible back pain. I guarantee that person has headaches. Only because, and one of the things we always say is you could be deaf, you could be blind, and you could be mute. And all we would do is take an x-ray and do some lab work, and we pretty much could figure out what your problem is, because labs don't lie. So symptoms that are happening on the outside a lot of times don't mean that that's the area that's necessarily having the issue. And in fact, the first example that I'm going to give you is going to be a dead giveaway, because we're going to talk about even the skin. And in fact, when people have skin issues, they think it's a skin issue. They think they need to treat the skin from the outside in, when in reality, the skin is a reflection of what's happening in the body's internal environment. So I'm going to go over with you three main things. And guys, if you're finding that what I'm going over with you is life-changing, if you feel like you are learning something new, please do me a favor and please share this video with other people, because there's a lot of people who just don't know. There's a lot of people who are just suffering when they don't necessarily have to, especially when there's an answer from the inside out. So let's get into it, guys. The first one I'm going to go over with you is one of the common symptoms, and this is anything that is affecting the skin. Now, if you look at this person here, and I see a lot of people that have this, they have what is known as rosacea, which is basically inflammation, changes in the skin along the cheeks, sometimes along the bridge of the nose. A lot of times we equate that with an autoimmune condition like lupus, for example. But the reality is, guys, is that whenever you are seeing changes in the skin, it's not a skin problem, okay? So let me say that again. Whenever you're seeing changes in the skin, in fact, the face will always be the most noticeable. It is not a problem with the skin, and I'm going to show you why, actually, according to medical research. So this right here, this is near and dear to my heart, because I see so many people who are chronically inflamed, and they tend to have very rosy cheeks, or they may be as bad as they start to develop pustules, or you can start to see actually the blood vessels at the surface of the skin. This even has to do with things like acne as well. So guys, acne is not a skin issue. This is actually coming from someone who did have a lot of acne in high school. In fact, I developed a lot of acne, and here's a clue, when I started to develop a lot of gastrointestinal issues. This had to do with me being on so many antibiotics, has to do with me eating so much processed sugar, has to do with me eating so much refined carbohydrates. And in fact, it led to so many different types of gastrointestinal symptoms, and the skin was just a reflection of what was happening on the inside. So one of the things that we do when this happens is we think, oh, I need to go to a dermatologist. They need to give me some kind of special skin lotion, or I need to cover it up with makeup. And guys, this topic right here is something that's absolutely near and dear to my heart. I'm going to show you a picture in just a second of literally the changes that take place when you start working not on the skin, but start working on somewhere else. And this happens, guys, like when people follow through with it and they've been tested properly, and when you start lowering inflammation in the body, okay? So I want you to look at these two pictures. Hopefully you guys can see this, but if you see this woman on the left side, and you're gonna notice a tremendous amount of inflammation as it goes across the bridge of the nose, across into the cheeks. Guys, we call this rosacea, and there's so many things if you follow social media, Instagram, Facebook, and they're always talking about the best skincare products, buy my skincare products. And guys, this person was trying to do skincare products and it wasn't working. And in fact, it got to the point where it was just something that was covered up by makeup all the time. Ladies, for example, if you are trying to cover this up with makeup, it is a problem not with the skin. Again, it's a problem somewhere else. So if you can see this, hopefully you can see it, and then you see the difference in the skin, how the skin cleared up. This is a difference of about 4 months. No special skin care products or anything like this. It was an inside out job. Now, pay attention to this because this is an awesome story. So when this woman started to have all of these different issues, there were other things going on associated with inflammation. When this person was tested, had thyroid antibody levels at about 2,400. Thyroid levels were really low. This person was also anemic. This person had gastrointestinal issues, and then also this person had absolutely no energy and was forced to sleep about 10 to 12 hours every single day and could also not work out in order to save her life. So this right here is not anemic. Thyroid antibodies levels went from 2,400 down to about 120 in about 4 months. And also started to increase her stomach acid and no longer anemic. Dr. Nate, what on earth did you do? Well, the first thing that we did is we tested properly. And in fact, we tested food allergies. We did a complete thyroid panel looking at 18 different markers. And then the other thing that we ran too is we ran an autoimmune panel. In fact, guys, so many people, they spend 5 years trying to figure out what their quote unquote autoimmunity is or the reason for their inflammation. Doctors are doing, a complete blood count and are saying, yeah, I see some of these labs are elevated, but we really don't know what to do with it. But when we tested this person properly, Hashimoto's, severely anemic, and then also had 4 different autoimmune reactions going on. One of them was Hashimoto's. The other one was associated with what's known as scleroderma, which affects the skin. And then the other one was actually having an autoimmune reaction. Now listen to this. An autoimmune reaction to the stomach cells that produce stomach acid. So you guys realize that when you cannot produce enough stomach acid, either due to some kind of stomach damage, autoimmunity, autoantibodies to the stomach parietal cells, or you're so stressed out that you're not producing enough stomach acid, then it's going to be a bad day within your gastrointestinal system. It's not a matter of if, it's just a matter of when, which is why when people are taking PPIs, proton pump inhibitors, my goodness, guys, there are so many things that are going to go wrong in your pursuit of not having acid reflux. So this is within 4 months, and we had to start rebuilding these things from the inside out. Now, the reason why this is so near and dear to my heart was this person started to develop these symptoms approximately 4 years ago, and this person is actually my wife. So everybody asked me to say, Dr. Nate, how did you get into this? How did you get into doing all of this? Well, I've studied, these things for years and years and years, but it really wasn't until I became a Wellness Way doctor was I able to put all of these different pieces together and truly understand how the body was actually working. And in fact, many times, guys, we go to a medical doctor, we go to a quote unquote functional medicine doctor, and they're basically just doing a this for that approach. Meaning, well, if you don't want to take a medication, then take this instead, it's more natural. But until you start to understand the Swiss watch principle that we teach within the Wellness Way, are we able to start putting all of these things together? So the thing is we gave her nothing for her skin, but what we did is we started to correct the cause, and where a lot of these issues were taking place was in the stomach and was within the small intestines. And in fact, I remember when I started off and started to help my wife, and by the way, she was not an easy case. In fact, my first case was my wife. I was forced to learn this because I knew if I couldn't help her, then I was gonna lose my wife, and that is really bad. And so it wasn't very easy because actually within about 2 weeks, I turned her into hypothyroid into hyperthyroid, and she basically almost had a heart attack, and she wasn't very happy with me. But it was just because we actually started lowering the inflammatory process so much, so quickly, and started to help her with her stomach acid and started to help her actually start to rebuild the gastrointestinal barrier. So this is after 4 months, and as long as she does the right things, then her skin actually stays clear. So there are so many ladies, listen up, so many who are having problems with their face, whether it's rosacea, whether it's puffy, swollen eyes, whether it's dark circles under the eyes, or whether it's acne. There is a common denominator between the two, and I'm going to link this together right now, actually using doctor's own research. So it makes you wonder if they're actually reading this. Again, this comes from PubMed. Dr. Nate, where did you find this on Google? Absolutely, I did. In fact, you can find PubMed, National Institute of Health, which has the archive of all the different peer-reviewed journals on there. And I found that this one was actually extremely interesting. And you would think that doctors would be reading this and being able to apply this knowledge, but they're not. Because if you have some kind of skin issue, what they're going to give you is some kind of steroid cream to put on your face. They're going to give you something to try to lower inflammation on the face, and they're going to neglect where it's actually coming from first. Now, during this article, this is what is so good. I'm going to read it to you, the ones that I actually have highlighted. So here's what they say. The gut microbiome is a major regulator, now listen to this, of the gut-skin axis. You probably have heard of all these different axes that they talk about, like the hypothalamic pituitary adrenal axis, the hypothalamic pituitary thyroid axis. So all of these hormones are actually are coming from the brain, and they're on this constant feedback loop. This is why, guys, the nervous system is so important, because the nervous system is actually responsible for its adaptation to stress. So your brain is responding to stress and is sending messages that is affecting your hormone system, which is, guys, why I'm actually going to talk about so many of you are trying to fix your problems with neglecting the nerve system. So the gut microbiome is a major regulator of the gut-skin axis, which means this: if you have a problem with your skin, you have actually a problem that's causing it is coming from your gut. So here's what they say. Intestinal dysbiosis, which means this: a state of dysfunction within the intestines, either a small intestinal bacterial overgrowth, or you're having yeast, which we actually just saw someone had massive amount of yeast growing within their small intestines today on a test. A state of microbial balance has the potential to negatively impact skin function. Okay, here's what they say. Most notably, the pathogenic bacterium is called Clostridium difficile. You guys have heard of this before, and it's called C. diff, and it's a very common infection that they get in the hospital, and the reason why is because they're dumping people with antibiotics so many times. So C. diff. Now, with a C. diff overgrowth, these metabolites can access, now listen to this, access the circulation, preferentially accumulating in the skin, and impair epidermal differentiation and skin barrier integrity. See, guys, your skin is a barrier. Your gastrointestinal system is a barrier. Your lungs have a barrier. The purpose of your barriers is to separate internal and external environment. And guys, whenever the external environment comes into contact with your body's internal environment, you are going to see a large part of your immune system sitting there. Where does a lot of your immune system sit? It sits in the barriers, and it's not necessarily within the blood. So here's what they say. Intestinal dysbiosis results in increased epithelial or skin permeability, which then triggers the activation of T cells, disrupting their balance with immunosuppressive regulatory T cells. Pro-inflammatory cytokines further enhance epithelial permeability and set up a vicious cycle of what? Chronic systemic inflammation. If your skin is inflamed, whether it's rosacea or whether it's acne, then one of the things is you have to look at what's happening at the gastrointestinal barrier. Here's what they say. This is what it gets even more interesting, guys. Please share this, because this right here, it makes a huge difference in people's lives. So here's what they say. Alternatively, the link may originate with GI dysfunction, which leads to psychological and cutaneous disorders, meaning skin disorders. So here's what they say is one of the biggest reasons why. Hypochlorhydria, which is a fancy word of saying low stomach acid, is frequently associated with acne. Imagine that. Meaning, if you have a decrease in stomach acid, the stomach acid is what sterilizes your food. The stomach acid is also what helps you to break down the proteins within your food. But here's the thing. When you have low stomach acid, what happens is that the bacteria that normally are supposed to live within the colon can now creep up into the small intestine, which is why they call it SIBO, or small intestinal bacterial overgrowth. Those bacteria are merely going to a place that is more hospitable for them to start growing. One of the biggest things, guys, and we neglect this in so many different healing arts, is the function of stomach acid. Do you know how many times I put people on stomach acid? Almost every single time, because the number one reason why people have low stomach acid is actually because of stress. A lot of it can be due to mental stress. A lot of it can be to chemical inflammation. And heck, I have had people actually just by adjusting them, starting to correct their spine and the nerve system, be able to go off of acid reflux medication because their spine and nerve system was a major stressor. So they say hypochlorhydria is frequently associated with acne. Low levels of acidity allow for the migration of colonic bacteria to distal parts of the small intestine, creating a state of intestinal dysbiosis and small intestinal bacterial overgrowth. Your gut issues aren't because you caught a bug. Your gut issues, first and foremost, originally happen because of a low stomach acid situation. What happens next in SIBO is this: malabsorbed nutrients, including folic acid, zinc, chromium, selenium, and omega-3 fatty acids have been shown to influence one's psychological state, and along with systemic oxidative stress have been implicated in the pathophysiology of acne. SIBO also results in the production of toxic metabolites, which can injure enterocytes, which are in fact intestinal cells, and increase intestinal permeability, and ultimately lead to systemic inflammation. Wow, isn't that incredible? So what happens is you have low stomach acid. Guys, please share this video. You have low stomach acid. It leads to small intestinal bacterial overgrowth. It leads to massive dysfunction. The barriers of the small intestine begin to break down. When the barriers start to break down, you will then not be able to absorb specific nutrients that are needed actually for the skin, but actually are needed in order to be able to manufacture different types of neurotransmitters, and can now lead to systemic inflammation. And once it becomes systemic, it affects the skin, it affects the joints, it affects literally everything, including affecting your brain. This is why it is beyond me when someone does have a major depressive state, why they are not looking at where much of your serotonin is made, which is in the gastrointestinal system. You guys realize that? Your brain is merely an antenna for what's happening within your body, which means if you have a depressed brain, you actually have a sick body first, not a depressed brain first. Does that make sense, guys? So even here, they're talking about acne, and they're talking about changes in systemic inflammation, and one of the major culprits is actually having low stomach acid. So number two, what about this, guys, is the whole idea behind headaches. Guys, so many people, in fact, headaches and lower back pain is one of the major sources of disability here in the United States. It's absolutely incredible. But there's so many people who have headaches who just shake it off and they just say, well, I didn't drink enough water, or I'm just kind of stressed. It's just a normal kind of thing. And guys, there's a lot of different reasons for headaches, but I will tell you this, there's not one headache that is considered normal, okay? There's not one. Headaches are a major, major sign that there is something that's happening in the body. Yes, it is tied to inflammation, but I'm going to show you the different types of inflammation because headaches can be caused by many different things, okay? So number one, what can cause headaches? I'm going to say the number one cause is actually your posture. And I know right now, probably all of you just did this, pulled your head back because you're like, oh, I need to work on my posture. Let me say this when it comes to posture. Posture is 100% subconscious. You are not actually supposed to think about it, and actually trying to fix it with your conscious mind doesn't fix it on an x-ray. So posture is actually controlled by your cerebellum, which is why when we're trying to work on correcting people's posture, it has to be completely subconscious, which is why we do specific things with adjusting, mobilization, why we're doing things like strengthening, head weighting, body weighting, vibration platforms, and things like that. Now, the number one posture, guys, and I see this so often, is this posture right here. So what you see is you see the forward head and you see that the rib cage is shifted backwards. Guys, man alive, this is so detrimental to your body because it actually lowers your oxygen carrying capacity, which can then in and of itself actually cause headaches. But the major reason why this posture leads to so many different types of headaches is because when the head goes forward like this, your brain says, I still need to start looking forward. So what happens when I'm doing this is I start crushing the neurology in through here, which is known as the suboccipital nerve that runs actually through the C1 and occiput and then innervates this whole entire muscle that comes to the front. So if you are having headaches at the base of the skull and it then even radiates around to the front, this most likely is a problem that's actually caused by posture, and the suboccipital nerve is highly inflamed because it's always getting compressed. Now, the other reason why you can start, are having headaches is because you're having a problem with your estrogen metabolism. Now, this actually is going to be a problem more related to what's happening with your liver because it's the liver that metabolizes your estrogens every single month. So if you are getting the once a month headache, and you're thinking that it's just PMS, you really need to relook at your hormone health and also with your hormone metabolism. Number three is it also can be an exertional headache. I've had exertional headaches, and a lot of times what happens is if you are working out and you're working out really hard, we've had people come in who say, oh my goodness, I did a really hard workout and I would get a headache for 2 or 3 hours afterwards. So this is known as an exertional headache. One of the biggest reasons why I've seen people who have exertional headaches is because when they demand more oxygen that needs to go to the brain, they can't supply that oxygen. And there's two big reasons why people can have exertional headaches. One of the first ones can be if they have a lot of gastrointestinal inflammation that's causing a lot of pooling of your blood around that area in order to have an inflammatory response, which means it's all around the abdomen and it can't get up to the brain. But the other reason why is something related to oxygen carrying capacity, which might be your red blood cells getting damaged because you have type 2 diabetes or you're pre-diabetic, or maybe you're actually do in fact have anemia, in which now you need to figure out why you are anemic. Guys, one of the biggest reasons why is just because of low stomach acid and B12 and iron absorption, okay? The fourth one is going to be due to stress. And guys, I have had some doozy of stress headaches. So when you are in a really hyper stress state, remember, your nerve system wants to dissipate that energy, and where it dissipates that stress energy is along the postural muscles of the spine. So just think, when people say, when I get stressed out, I feel it in the back of my neck, I feel it down in the traps, I feel it into the shoulder blades, and this can be due to stress. So when you look at this, guys, headaches, again, are not normal. They're very common, but they're never ever normal. And usually what happens is when you start to become inflamed, these things will start to come out. But headaches, guys, I've seen it have absolutely crushed people with their lives. And, headaches aren't necessarily a really hard thing in order to correct if you understand biomechanics, if you understand hormones, if you understand inflammation, the digestive system, and stress, and how to start working all of those different things together, okay? Now, the third thing I want to go over with you is when you have chronic joint pain and or you are having a lot of soft tissue pain, okay? So I will tell you this, when I was 22 years of age, I got my first x-ray because I was having terrible lower back pain. The kind where I would, I could sit and then I'd have to stand and I'd have to lay down. And I went through basically a year of absolute misery and no one was giving me any kind of answers. And I would wake up and my pain was about out of 8 out of 10. I could hardly walk, tingling into both my feet. It was just really bad. But when I look back, I was so unbelievably inflamed and I had so many other soft tissue injuries, shoulder issues, lower back issues, plantar fasciitis, IT band syndrome. You name it, I pretty much had it. And I always thought, why on earth am I so injured? Why do I get injured so much? And it wasn't because of bad luck. It wasn't because of bad genes. It was because I was so unbelievably inflamed. Remember, at that point, I had asthma. I had swollen tonsils, had my tonsils out as well, irritable bowel syndrome. You name it, I pretty much had it. And I'm thankful that I had the opportunity to go through that suffering because it's only through suffering that you actually develop the will to learn why. And it was also helped me to be able to empathize with people a lot more with what they're going through. But let me say this, there's some people who come into my office and I know they're not doing what they need to do. And they say, oh, I don't know why, but my back hurts so much. I'm like, well, what did you eat last night? Or people will say, yeah, I'm starting to develop some issues with my back or my neck. And why is that? And I'm like, well, you did something to spike inflammation. Look in the gastrointestinal system first. But when people are having issues with chronic back pain, you guys know the IT band syndrome, or you're having problems with plantar fasciitis, you're having problems with the soft tissue, you really, especially if you're getting it in more than one area, like you're getting it in both sides, you really need to start looking at what's happening on a systemic level when it comes to your soft tissues especially. So yes, it's inflammation, and it also can be related to blood sugar because again, high blood sugar, high insulin destroys the soft tissues because think about it, they measure A1C because A1C is soft tissue and they're looking at the degradation of your red blood cells, which is a soft tissue, and so are your joints. So are your soft tissues that are around the joints. So if you have these that are going on, even for some patients, I'm like, I really wish you would just, kind of bite the bullet and start to get tested properly and then start working on changing your lifestyle especially. But if this is something that is chronic, these are all things that I have had, and it's when I get really inflamed, will I have this or will I have IT band syndrome or will my back actually start to really hurt? Going back to when I was 22 years of age, they took an x-ray and the radiologist was like, you have massive degenerative disc disease. And I'm like, but I'm 22. He's like, yeah, but this looks like it started about 10 years ago. So fast forward 22, now I'm 45 years of age. So I've lived actually most of my life having a massively degenerative disc in my lower back, but I can still do all the things even more than I could when I was 22 because I know how to handle the inflammation. My question is do you? Do you know how to handle that inflammation? So when it comes to having a lot of joint pain, when it comes to having a lot of issues with your soft tissue, the thing that you have to look out for is, yes, what your posture is. Guys, when you have a posture that looks like this, you primarily do way too much sitting. Your core strength has absolutely been destroyed. You probably have really bad hip flexibility as well. You need to correct what's happening with forward head posture. And probably one of the biggest things that I see in people is their inability to be able to extend their rib cage or extend their thoracic spine. So if you can't extend that, then you tend to go into what's known as the nursing home posture, or we will know as the granny posture, which you get the big hump on the back and have the saggy chin, okay? And then you have to look at inflammatory markers as well. I'm going to go over that in just a second. You have to look at what your blood sugar, your A1C, and your insulin levels are. But also too, guys, is that you can get really inflamed. Your tissues can really hurt if you are low on electrolytes. And people I have seen clinically are historically low in electrolytes. And what I mean by that is things like magnesium, potassium, and then also sodium, which is why for a lot of people, when they first start, we'll tell them to start taking a teaspoon of unrefined sea salt, Celtic sea salt, pink Himalayan salt. We'll tell them to start taking about 3,500 milligrams of potassium every single day. We'll start actually getting about 1,000 milligrams of magnesium, because most people are so electrolyte deficient, and this is specifically true for people who are exercising all the time. If you tend to be very low in electrolytes, it can cause a lot of spasm of the soft tissue. And yes, this can be related to things like IT band syndrome, and a lot of it is related to your structural integrity. But then if you happen to have this, it tends to hit it twice. So start getting, guys, a lot more electrolytes in the form of magnesium, in the form of potassium, and then also in the form of sea salt, okay? One of the questions that I always get, I just kind of shake my head at, is that people on different types of blood pressure medication, and we put people on maybe half the amount of potassium that they need in one day, because you need about 4,500 milligrams. And they'll go to the doctor, and the doctor says, that's way too much. It's way too much potassium. And I'm literally saying, you mean to tell me that you're going to tell your patients not to eat a bunch of vegetables that have potassium in it? I never understand that, but doctors tend to freak out, mainly because they don't understand the mechanism of action of their own medications that they're actually prescribing. Now, when you look at this, guys, I'm going to show you someone who basically came in and had all these symptoms. So no energy, rosacea, had a lot of problems in the gastrointestinal system, also had problems with back pain, neck pain, knee pain, you name it, common symptoms, and also headaches, and had all the common symptoms of inflammation that everyone thinks is normal. Excuse me. So we ran the blood work. Number one, blood sugars at 165, way too high, type 2 diabetic. Hemoglobin, A1C, 7.8, needs to be under 5.7, type 2 diabetic. His insulin levels at 37, way too high, insulin resistant, soft tissues are getting absolutely hammered and destroyed. And C-reactive protein, which is a liver inflammatory protein, is at 7. Guys, this needs to be at 1. So here's a person who is massively inflamed and is a type 2 diabetic, excuse me, and everything hurts and no energy and just feels absolutely awful, and only 48 years of age. So many times, guys, we don't feel good in our 40s or our 30s, and we just think that's just the way that it's supposed to be. Guys, we're not supposed to age this way. Anyone who tells you otherwise is flat out lying or just doesn't know, because the reason why we start feeling worse as we age isn't because we're getting older, it's because we're getting more inflamed and we are just getting more beat up, and we're not doing the things in order to be able to heal and be able to repair. So if this person can follow through and can do exactly what he needs to do in order to lower the inflammatory stressors, in order to become more insulin sensitive, in order to be able to lower his blood sugars, this guy is going to feel amazing. Now, how long is it going to take? It's not going to take a month. It's not going to take 6 weeks. And in fact, heck, some people, they get frustrated after 5 days. How long is it going to take for this person to be able to recover? Probably a year to a year and a half. And people say, well, that's a long time. I'm like, not when you were destroying yourself over the last 35 years. So it takes longer, guys, than what you think that it's going to. But at the end of the day, it doesn't matter. If you're moving forward, how long it takes, it should never, ever matter. You should be resolved to get your health back, no matter how long it takes, no matter, looking at your progress from day to day, because you're going to have good days, you're going to have bad days. The goal is you're going to have more good days than bad days the longer that you continue to do this. But guys, what this takes in order to be able to heal and recover from all of those different things, the biggest thing that it takes is for you to develop a different mindset. Because the same person that got you sick is not the same person who's going to get you better. Let me say that again. The same person who got you sick, which was you, is not the same person who's going to get you better. And ultimately what you have to do is you have to become a completely different person. And I know change was so hard for me because what I was trying to do is I was the same person trying to create different habits, but the habits came easy when I became a different person. When I changed my mindset and became a different person, the habits naturally followed. So guys, those are the three different signs of inflammation: headaches, changes in the skin, rosacea, acne, and then finally having chronic soft tissue pain and chronic back pain. Guys, this happens so often. In fact, this is one of the first things that people start to notice that are getting better are these things, and it's only because we know what it takes in order to lower those inflammatory triggers. So let me ask you this, guys. One of the reasons why you haven't gotten better, one of the reasons why you've been on a journey for so long is because you're trying to find the outside-in approach. You're trying to find the magic, I'm not going to say it. You're trying to find the magic skin serum for your face. You're trying to find the magic shampoo in order to build healthy, voluminous hair. You're trying to find the right skincare lotion or why your skin is so dry. You're trying to find the right type of counter irritant like Bengay or Blue Emo in order for your joints. You're trying to find the magical knee sleeve. You're trying to find the magical wrist wraps. You're trying to find, the outside-in approach. And the reason why we're so desperate to try to find this outside-in approach is because we really don't want to blame ourselves for getting us sick. I know that's really, really tough to stomach that, but once you can say, I'm the reason why I'm sick, it's then and only then can you start to make a complete recovery. So is it outside in or is it inside out? All health, all healing comes from inside out. You want to change your skin, it's inside out. You want to change the amount of pain that you have, it's inside out. If you want to change your energy, it's inside out. If you want to improve your sleep, it's inside out. It's never outside in, and that's the reason why you haven't discovered on how to get your body better. So guys, I appreciate you listening to me. Please make sure you share this video if you found this enlightening or if you learned something from it. Guys, coming up, I know that we already have people registered. I believe you can find this, should be finding this at the top of the page. I believe it's April 12th, which is a Tuesday, is our next inflammation talk. Yes, this is an in-person event. But guys, when we talk about weight loss, we talk about cancer, we talk about hormone issues, infertility, thyroid issues, when we talk about type 2 diabetes, autoimmune issues, hormone quote-unquote imbalances, it comes from inflammation. So at that event, we're going to talk about how you find the chemical stressors, the mental stressors, the physical stressors, and how you start that journey to help your body heal and recover so that you can become your best and not a stripped down, watered down version of it, which I see so many people every single day. And that's what breaks my heart. And that's what keeps me going every day. So if you are from the Yorkville or the Chicagoland area, please make sure that you register for it. This is an in-person event, and we have spots for about 25 people. That's it. When they're gone, they're gone. And guys, I will be jumping on maybe once or twice later on in the week, impromptu, if I run across anything that you might like. And guys, I hope you have a great Monday. I am off to work out a little bit late. So be well, be healthy, and remember, health is an inside-out job. So guys, be well. We'll see you guys really soon.